Hi, I'm Jen from JenThereDoneThat, and 2 weeks ago I had surgery. Many of you are asking me for an update, so here we go. If you haven't already watched my surgery video, I'll go ahead and leave that in the link above. And I am now 2 weeks post-op. I met with my surgeon, my doctor, just 3 days ago for my post-op appointment at the doctor's office for my 2-week post-op visit. And the surgical masks are required. You cannot use the reusable cloth masks. And we're getting ready to see how I did after surgery. For my post-op visit,
Yes.
What do you look for when I came in, just to like, when I walk through
To evaluate how you're doing. So we want to see how is your pain management and how you are handling your day-by-day activities. So once you arrive to the office, how you're seated in the chair in the waiting area, how you walk towards me while approaching the examination room, how you are dressed, how you're taken care of. Because sometimes if we have a bad pain management, we will just throw in like a t-shirt and some pants and just be here like checking yourself and I want to leave because I don't feel well. When you feel...
I put on makeup.
And you have like a ponytail and you look all gorgeous as you always do. So that is really positive. And it's just been 1 week, so all of this is good news for me.
Yeah, so we can change, but yeah.
We can improve. There's always space for improvement, and that is really important. So managing our expectations of what the post-op course will be is really important and crucial right now.
Great.
Okay, so we're doing good, Jennifer.
Thank you.
I am so happy.
So great post-op visit. I got the all clear from my doctor, and I'll be back in 3 weeks for another checkup and feeling really good. Now let's talk about the cost. The actual medical care that I received here in Puerto Rico was excellent. The surprising thing was the cost, and many of you have asked me about healthcare cost, healthcare recommendations, and overall just wanting to get a little more information about it. So I will have a few more of these videos. Please leave your questions and comments below of what your healthcare questions, what your medical questions are, and I'll address those in a future video. As far as costs are concerned, so the evaluation and the referral was done by, originally the referral was from my primary care physician. I currently belong to a concierge health plan in addition to my health insurance. So I have SSS health insurance. I used to pay for something similar with Blue Cross Blue Shield in the United States, over $350 a month, and now I pay $178 for my SSS health plan. It's an excellent health plan here in Puerto Rico, and I pay an additional fee on top of that for a concierge plan. I started last year with Pravan because I was having health issues, and I knew that this year was going to be a medical nightmare. I didn't know how much of a nightmare it's going to be, but it was very good planning on my part. So my primary care physician referred me to the specialist, and so that referral and evaluation, everything was covered under my concierge plan. So it was zero. It didn't cost me anything, but my normal copay would have been probably $20. From there, I had a whole bunch of, once I was diagnosed and ready for my surgery, I had a whole bunch of pre-op labs. So I had a chest x-ray, $34 was my copay. Then I had a whole series of pre-op labs, a ton of blood work. I can't believe how much blood they took, but a ton of blood work. And of course, because it's 2020, my COVID test. And all of that was right around $49. So just under $50 for all of my copays for those labs plus the chest x-ray that I had done at another facility for $34. My my hospital copay was $300. That's it. I had 3 days, 2 nights in the hospital. The total was $300. Then I've had one post-op visit. My copay was $20, and I will have a second post-op visit in 3 weeks that will also be $20. So if you're keeping track at home, it is $424 out of pocket total for 3 days, 2 nights hospital stay, and surgery, including all of my pre-op work and all of my post-op. I don't know, there's no way I would have had this surgery performed for that price in the States. My last insurance plan would not have covered anywhere near that. My copays for the labs alone would have cost me more than what the entire thing cost me here. So yeah, the healthcare is significantly different here in Puerto Rico, and it's significantly less expensive. Part of that is, they don't supply pillows and blankets, but it's also just a completely different healthcare system. And I think people don't quite realize that. We are a U.S. territory. All of our doctors are U.S. board certified. All of our doctors speak English. The office staff and receptionists may not, but the doctors are trained and speak, read, write English. That's how they're tested. That's how they get their certification. So they're excellent, excellent doctors. And as long as they keep up their continuous education, I've had wonderful healthcare here. But the prices are just unbelievably low. So I don't feel like I got any less care here. In fact, I think I got more. I had a big private room. I've had more time with my doctors, my surgeons, my team of doctors. Have all coordinated to make sure that my pre-existing conditions and getting ready for surgery. So the quality of care here is incredible and at a budget price. So I will be addressing more of the healthcare system and just medical in general in Puerto Rico. Like I said, please leave your questions and comments below so I can address those in future videos. But that's my update. I'm feeling good. 2 weeks post-surgery, I'm cleared for light walks and taking it easy. But I feel a lot better, and I know that I'm definitely on the road to recovery. So hopefully this is my last surgery for a little while, and now I can just focus on recovery and getting better and getting back out there for hiking and scuba diving and doing all the fun adventure activities and just enjoying my life here in Puerto Rico. Thanks for watching. Be sure to like and subscribe for more videos from Jen There, Done That in Puerto Rico, in the hospital, post-recovery, the Caribbean, and beyond.